What's the boogeyman in the room around birth? Pain. Simple as that. When we developed these skills in the early 1970s, it was a big issue. This is what we often talked about. Well, at the beginning of labor, the contraction pains weren't too bad and I coped fine. Then they got more intense. I had a little bit more trouble coping. Then they got really intense and I lost it. Well, we didn't want to lose it. And the skills in the early 1970s, the Lamaze and the Bradley skills, they often didn't work for us. Or if we had lots of medical care, lots of interventions, assessments, monitoring, and procedures, and we thought we were going to have a more natural birth, we stopped using the skills. So in this lesson, we're going to really drill down and help you understand the natural occurring pain of labor. It is unique. It's often called productive. That doesn't make it easier to cope with. There are many women who feel they're going to die from the pain because they can't control it. Your job isn't to control the pain. Your job is to feel in control when you're experiencing pain and to know how to open up at the same time. In this lesson, you're going to have some handouts on the hows and whys of pain, how to work with pain. Then you're going to have 3 audios. One is childbirth pain, just explaining that again in an audio format, and then birth pain tips, how to utilize birthing better skills as you're experiencing pain. And this will tie in with the lesson about the 5 phases of contractions and the bell-shaped curve. And then there's another MP3 on why fathers make great birth coaches. Men see and hear how a woman is responding. They can see it in our forehead, if our forehead is relaxed or like that. They can hear it in our voice, if our breathing is or they can help. They need the skills. You need to share these skills together. Remember, pick and choose what each of you want to learn and learn different things at different times and then share with each other. It's easy and it makes it so much more enjoyable when you're both learning what you want to learn. In one of the other lessons, you'll find a handout called a positive negative voice. We thought about putting it in this lesson, but it's not. So find out what happens when you have negative thoughts during your birth and how you can manage well. Now, pain is not just for women who are laboring. Women who have surgical births experience pain as well, and many of us experience postpartum pain. So just use these skills. Simple as that. They become life skills. As one dad said, I used them when I was getting tattooed.